Good evening, everyone. Welcome to part 3 of our maternal mortality webinar series. Just wanted to, again, put up the continuing education statement. We will be sending out the evaluations. We are still pending the approval based on availability of staff at the College of Nursing to process the application. So we will keep you updated as we get more information about that. At this time, I'm going to turn it over to our president, Lisa Davis.
Thanks, Kate. Good evening. Again, my name is Lisa Davis, and I am the president of the Midlands of South Carolina Black Nurses Association. We are one of 115 chapters of the National Black Nurses and one of 3 in South Carolina. We are pleased again that you're joining us for, this is our 3rd session of this 3-part series on maternal mortality. Does race matter? And I think by now we can all say yes, race does matter. We were able to kind of go through the data on our first session, then go through the programs, and now talk about implicit bias and maternal mortality. We will be reaching out to those of you who've registered online and invite you to a follow-up call to action session. So that will be forthcoming. I'd just like to thank our chapter members who've done a great job putting together such a robust webinar series. And I'd like to turn it over to tonight's moderator, Lori Vick.
Well, good evening and welcome. I am going to talk with you a little bit about our presenters for tonight, as well as ask you to please make sure that you have muted your phones. Know that we'll have question and answer at the end of the program. Please put questions in the chat box and we'll make sure that we get to those. There will be links to the recordings on our website, and that is www.midscbna.org. So please do visit that site. And I will put that web address in the chat box too, so that you have access to it. All right, now for our presenters. Curisa Tucker is one of the presenters tonight, and she is a member of the Midlands of South Carolina Black Nurses Association chapter. She has been a maternal newborn nurse for the past 11 years. She is currently a nursing instructor at Midlands Technical College and teaches pharmacology and maternal newborn nursing to pre-licensure nursing students. She has always had a desire to help new moms and babies. She is a PhD candidate at the University of South Carolina College of Nursing with a primary focus, her research focus in Black maternal mortality and maternal health disparities. Her dissertation will assess the impact of patient-centered medical homes on maternal outcomes using Medical Expenditures Panel survey data. Our second speaker is Dr. Coretta Jenerette. Dr. Jenerette is a professor and the Associate Dean for Diversity, Equity, and Inclusivity in the College of Nursing at the University of South Carolina. She earned her PhD and MSN in nursing from the University of South Carolina and a BSN from Clemson University. She completed a certificate in nursing education at the University of North Carolina at Chapel Hill and is a certified nurse educator. She also completed postdoctoral fellowships at both Yale University and the University of North Carolina at Chapel Hill. Dr. Jenerette is a fellow in the American Academy of Nursing, a Macy Faculty Scholar, and the treasurer for the International Association for Sickle Cell Nurses and Professional Associates. Dr. Jenerette's internationally recognized program of research is aimed at enhancing self-care and family management in vulnerable populations, such as persons with sickle cell disease. She is dedicated to educating future nurse scientists about the role of social determinants of health on health outcomes and their role as social justice advocates. And I think that was someone cheering for Dr. Jenerette. Go, 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 right? So welcome you all, and Dr. Jenerette.
Thank you so much, Lori. We would like to add our welcome, my co-presenter and I, and we would also like to acknowledge the presenters from the previous webinars. They certainly basically put us in a great position to continue this discussion with the discussion of mortality data and the overview of some programs that are available in South Carolina. So if Curisa would share the screen and the slides, we will begin, and I will begin by talking about our objectives.
Do you see, I'm sorry, do you see presenter view or?
No, I see, there we go.
Okay.
Okay, next slide, please. So our objectives are pretty straightforward. We want to define implicit bias, and then we want to discuss the impact of implicit bias on health outcomes, including maternal mortality, use some case discussion to increase awareness of implicit bias on maternal outcomes, and then provide some recommendations, which I think the audience can certainly contribute to increase awareness and lessen the impact of implicit bias on maternal outcomes. And most likely, these recommendations could be used in other areas of healthcare in addition to in maternal mortality scenarios. Next slide. So what is implicit bias? It is also known as unconscious bias. By definition, it's beliefs and or stereotypes about a certain group or groups of people or individuals that are formed without the individual actually being aware of it. Everyone holds unconscious or implicit bias. That's something, the first thing that we must acknowledge in order to combat it. Most often, implicit bias is related to race, ethnicity, age, sex, gender, gender identity, weight, religion, socioeconomic status, and there are some others. So sometimes pictures speak louder than words. So I added this cartoon to illustrate implicit bias. And although we are going to take some questions at the end, we also we encourage you to also be interactive with us now. So in this cartoon, I'm not sure if you can see it. I'm not sure if I can see it. The first character says, "Hey, do you want to play tennis again after work today?" And the second person says, "Sure, that sounds great. Should we invite Julie?" First character says, "Oh, I don't think she's a member of our country club. Membership is really expensive." Second person says, "Yeah, you're right. I guess we shouldn't mention it." They're trying to save her, I guess. So then the first person says, "Probably not. Anyway, while we play, we can also brainstorm new ideas about next week's pitch meeting. I'd love to hear what you're thinking." And the second person says, "Works for me. We can catch Julie up tomorrow." So someone can either raise your hand, unmute, or put it in the chat box. What types of biases do you see there? Or if you see any bias, is this a problematic discussion? Something that you're used to perhaps, or that you've seen before in the workplace? I see all your names. I can call on someone, and I know some of you quite well. Lori typed in the chat box SES, socioeconomic status, classism, exclusion. Thank you. So definitely some assumptions going on that would impact outcomes and probably be very disruptive in the workplace. You can move to the next slide. So cartoons may help some, but let's take it up a little step further. Hopefully some of you have seen this powerful video produced by Procter & Gamble called The Look. It is certainly readily accessible on YouTube if you haven't, and you can use the search terms P&G, The Look, and find it. So Curisa, you should be able to play that video. Oops, it went to the next one. Maybe not. Let's see. I guess
I'm gonna stop sharing and see if it'll.
Because it plays from mine.
1 second.
Okay. So in the chat box, how many of you have seen this video already or familiar with it? Nope, Kate has not. Good. I haven't seen it, but I heard about it. Dr. Felder, not familiar. Yay, so you are in for quite a, oh, of course, Cheryl Mitchell has seen it. She's probably read about it too, our book person, Dr. Mitchell. Yay. So if you can't pull it up, Chris, I may have to share my screen and show it. So
Is this it?
Yeah. Yep. And if you make it larger if possible. Perfect.
Rise.
Who said that?
The lady at the store.
That is not a compliment.
Yeah. Thank you so much, Curisa. So what do you all think about that video? Very powerful. Thank you, Lori. So that video was obviously produced to show the impact of implicit bias and we can see multiple instances of implicit bias in that video. So Curisa, are you able to share your screen again in the PowerPoint? There are multiple instances of implicit bias in that video. So right beside that video on the screen is a still shot. So I think we are all impacted by the continued murders of Black people, Black men in particular in the US. But the screenshot of the we didn't see him as a threat is from the Kenosha, Wisconsin shooting. And the person with his hands up is carrying a gun and was not seen as a threat. This was explicitly stated by one of the police officers on the scene. So if you compare the reaction to the African American or Black male in the P&G video, you can automatically see the impact of implicit bias, where he was seen as a threat, seen as less than desirable. People were avoiding him, thought he was doing things that were illegal, or maybe not in places that he shouldn't be, etc. Compared to the white person who was actually doing something illegal and doing things he wasn't even qualified to do if he were doing the right thing, because he was underage. So these two, a video and a photo, actually say a lot. So why are we talking about this instead of maternal mortality? Well, the link is that the same thing that we see in society, we're going to see in the healthcare system. The healthcare system is only a microcosm of the larger society. The same people who get on the elevators with us or not, or shop in the grocery store, are the same people who are our healthcare providers. They bring their biases with them, and they can impact health outcomes. We know that often healthcare providers provide care based on experiences and not based on how they're trained. So we are fighting an uphill battle to mitigate the impact of implicit bias. So hopefully you've had have had a kind of a foundation in implicit bias, and or built on what you already knew. And now I am going to turn it over to my expert in maternal issues, Miss Curisa Tucker. And she's going to provide us some cases that we can actually have some additional dialogue about, and then we'll end with some recommendations.
Thank you, Coretta. I appreciate that. And thank you, Lisa and Lori, for the introduction. First, I would like to stop and ask Lori, are there any questions or comments that we need to address in the chat box before I move on?
Yes, I've been writing, but there's others also. So let me go to the others. Someone shared, sometimes people are seen as a threat based upon the color of their skin. In the two scenarios that were described, we have a Black man with his child versus a white man with a gun, and the white man with the gun is not a threat, but the Black man with the child is perceived as a threat. And goodness gracious, and then I just say it just seems like such a mountain to climb to try to get some understanding about that. So that's all we have in the chat right now. Thank you.
All right, thank you. So as Coretta mentioned, I'm going to discuss some case studies that have happened in relation to maternal mortality. Many of you may be familiar with this case. This is Kira Johnson. I'm also going to play a video. Stop sharing my screen here. I apologize for my technology challenges here. Okay. All right.
My wife, Kira Dixon Johnson, was the closest thing that I'd ever met to a superhero. She made me far better than I ever thought I could be, and she was far better than I ever deserved. We're talking about a woman that ran marathons, that raced cars, that spoke 5 languages fluently. So we were blessed to welcome our first son, Charles, on September 18th of 2014. We always wanted back-to-back boys, and we were blessed to find out that we were going to welcome our second son, Langston, in April of 2016. We walked into Cedars-Sinai Medical Center on April 12th of 2016 with a woman that just wasn't in good health, she was in exceptional health. We went in for what was supposed to be a routine scheduled C-section on what was supposed to be the happiest day of our lives, and we walked right into what was a nightmare. Shortly after the procedure took place around 2 o'clock, shortly afterwards, we went back to recovery. As I'm sitting there reflecting in all this glow and pride of being a new father for the second time, Kira's resting, my new baby is resting, and as I look at her bedside, I begin to see the catheter begin to turn red with blood. I brought it to the attention of the staff, the nurses at Cedars-Sinai. They came in. They said, we're going to do a couple of things. We're going to order a set of tests, and we're going to order a CT scan to be performed stat. I was concerned, but I said, you know what? My wife is healthy, and what's supposed to be one of the best hospitals in the world. I'm concerned, but we've got a plan, okay? Blood work comes back. It's showing that it's abnormal, and she's hemorrhaging. And they ordered a CT scan that was supposed to be performed stat. Keep in mind, this is around 4 o'clock. 5 o'clock comes, no CT scan. Her blood levels are continuing to drop. By this time, she's beginning to shiver uncontrollably. 6 o'clock, no CT scan. She's beginning to become pale. She's in extreme pain. 7 o'clock comes, 8 o'clock comes, no CT scan. I'm begging, I'm pleading the staff to do something. And around 9 o'clock, as I continue to plead for my wife's life, the staff at Cedars-Sinai Medical Center tells me, sir, your wife just isn't a priority right now. 8 o'clock comes, 9 o'clock, 10 o'clock. They said, well, we need to do a blood transfusion. I'm saying, well, where is the CT scan? It wasn't until after midnight that they finally took my wife back to surgery. After I begged and pleaded for them to take action for more than 10 hours. When they took Kira back to surgery, they opened her up, and there were 3.5 liters of blood in her abdomen. And she coded immediately. Now, I'm here to tell you this. I'm not here to tell you.
Okay. So as you see, that is the story of Kira Johnson being told by her husband, Charles Johnson, who has created a nonprofit organization in memory of her life. If you are familiar with Judge Hatchett is actually her mother-in-law. And that actual footage came from when he testified in front of lawmakers in DC a few years ago about her case. Now, this is some open dialogue and discussion, so please unmute your mics as we have this discussion. In general, what's your opinion about what happened to Kira? And in what ways did implicit bias potentially operate in this scenario? Does anyone want to share?
Well, of course, they made the assumption that she was not hurting as bad as she was.
Right, they made the assumption, and they pretty much kind of downplayed his concerns, right? Anyone else?
When he said that she was not a priority for them right now, what did that really mean?
Right, that was definitely not the right thing to say. Basically, all patients should be a priority especially when they're getting care. So a lot of things happened during that situation that we know shouldn't have been said, shouldn't have been done. As a follow-up question, do you think that any stereotypes were invoked from the doctors or the nurses in that situation?
This is Coretta. So even though I'm a co-presenter, this is the first time I am seeing these videos, and that was powerful. I had not heard of her story, but because of my work in the sickle cell community, care seeking is something that we look at a lot. And I've heard people with sickle cell say, oh, I dress up when I go to the emergency room and they treat me different. So his wife obviously was a professional, spoke all these languages or whatever. And the one thing that a patient with sickle cell told me that I will never forget, it doesn't matter how you look coming into the hospital, once you put on a gown, everybody looks the same. So if you have preconceived ideations, if you have biases against Black people, You're not going to know she's an affluent person. You're not going to know all these things about her. They treated her just like they would probably treat any other person. But obviously the issue is if you treated everybody the same, it really wouldn't matter. It is very sad. I think as I grew up, we always were taught that when you're pregnant and giving birth and labor and delivery, you always have one foot in the grave because so many things can go wrong with the massive amounts of blood and potential for blood loss. It is very sad to have these avoidable deaths. So I'll stop there because I could be on a soapbox for quite a while and Curisa would send me a message probably.
Hi, my name is Tamika Isaac, and I actually just joined a little late, and I apologize for that. And I just wanted to share a little bit about this story. Always resonates with me because I had a very similar experience to Kira. I was about 35 weeks pregnant, and my son was measuring small 1 week at the hospital. The next week, they said he failed a non-stress test. I was sent to maternal fetal medicine 2 weeks in a row for an ultrasound. The first one, they said he was blocking, his name is Jace. They said he was blocking the umbilical cord, so they couldn't get a good reading. And then the next week they said he was fine. That Sunday, so it was a Thursday, that Sunday, I had a very bad stomach ache and I really thought I had to use the restroom. And I couldn't, so I ended up throwing up. That morning I felt really sore and I called into work and I just really didn't feel well. So I laid in bed all day. My friend came over to help me. So around 4:45, let's say 4:30, 5 o'clock, I asked her to come help me go to the restroom and I passed out as I stood up. I was rushed to the emergency room. There we found out my son was stillborn and I was diagnosed with HELLP syndrome. I had stayed in the ER from 6 p.m. until 9:59 when they did a CT scan. If you know anything about HELLP syndrome, it's a critical condition. At 9:59, they did a CT scan. In between that time, they told me I had to go to another hospital because my heart rate was really, really high. So they needed somebody to monitor my heart. They didn't have anyone there to do that, so they needed to transfer me. I didn't get transferred to 10:43 p.m. As I'm in transit, the CT scan that was sent to the other hospital, one of the surgeons noticed that I was bleeding internally. And at that point, in transit to the other hospital, of course, it goes to an emergency surgery at the other hospital. Come to find out, there were tests that were missed during my pregnancy, and no one really realized that I was missing random, urine samples, blood work, any of that. And Kira's story was actually the one that kind of opened my eyes to maternal mortality and the whole situation. And I just I don't know why I wanted to say this right now, but every time I hear about her, it brings something up in me. It's kind of like a passion and an anger because through her story, I realized what was happening because I didn't know that I should know more than I did when I was pregnant. I didn't know what tests were standard and what tests weren't standard. And I'm also well educated. I can't speak a bunch of languages. I just speak English, but for the most part, I was not one of the stereotypical things that they say happens or why Black women are dying in childbirth. So I had a, Blue Cross Blue Shield. I wasn't on Medicaid, all that stuff. And this story kind of just always fills me with a little bit of rage and a little bit of passion and just a little bit of fight, because it's these stories that steered me in a direction to start a nonprofit myself for my son, because I felt like he saved my life for something, because I was very, very, very close to death. And I just really want, I don't know why that all just came out, but I just wanted to share that because this story always just brings something out in me to just want to reach people and to tell people that this stuff is so real and it's so wrong, but it's so real. I think I'm done now. I'm sorry.
No, we really, really appreciate you sharing your story. And number one, I want to say, thank God that you made it. Thank God that you're here. And what you're saying is, you know, shared by a whole lot of women on in this country, unfortunately, that have experienced the same things that you have experienced. And it's unfortunate that because of the color of your skin, most likely, that you weren't given the treatment that you were deserved. And like you said, implicit bias and stereotypes, etc. It doesn't matter your income, your education, you know, where you live, your insurance status. You know, unfortunately, when some people view your skin first and have these biases in the back of their mind, they don't provide care like they should. And it's very unfortunate. And we've seen that play out in, you know, our current climate with everything that's going on in the media, especially in regards to, you know, Black Lives Matter, et cetera. So thank you again for sharing your story, and we really appreciate that. Thank God you're here. All right. Next, I want to move on to another case. This actually happened here in South Carolina. I don't have a video on her, but her name is Yolanda Minchin. And on the left here is her husband and her daughter who she gave birth to. So she was a case that happened at McLeod Hospital. So bear with me, I'm going to read her story. As her due date approached, and then after her baby Serenity was born, Yolanda's blood pressure rose. In the hours after the Minchins got home with their baby, Yolanda's headache wouldn't go away. But it was just a little headache, she reassured her husband. That evening, Marco left with her family and drove to their nearby church for choir rehearsal. A half hour later, Yolanda called. My head really hurts and it won't stop, she told him. Her blood pressure was in the 180s. Marco canceled rehearsal and drove Yolanda back to McLeod Regional. They got there around 11 p.m. Yolanda told the ER staff about her blood pressure readings, and she had just been discharged for delivering a baby. She complained of an excruciating headache, describing the pain as 9 out of 10. The nurse measured Yolanda's blood pressure. It was 209 over 117. The ER staff sent Yolanda for a brain scan, but afterward returned her to the waiting room without seeing a doctor or getting treatment. She waited 3 more hours. My headache is getting worse and my eyes hurt, she told Marco. At that time, it was 3:52 a.m. Yolanda asked the ER nurse to take her blood pressure again. It was 216 over 104. Marco said he then went up and banged on the desk and demanded that Yolanda be seen. A nurse finally took her to an exam room more than 5 hours after she had arrived to the ER. As they waited in the exam room for the doctor, Marco watched his wife's face droop. Her speech became slurred. He tried to get her to squeeze his hand. She couldn't. A few days later, she was dead. Blood vessels had burst in her brain. Okay, again, that's another very sad story. That story was reported in several news outlets and in the media. Again, that happened locally here in Florence, South Carolina at McLeod Regional. So again, I want to open up with some questions. What's your opinion about what happened to this patient, and how do you think implicit bias played in the unfortunate death of Yolanda? Please unmute your mic.
Curisa, I think something that strikes me about all of these stories is the ignoring of very obvious things, and that people would probably stand there and say that they didn't realize. And it just shows how strong their bias was, that they couldn't even see through to be like, oh, well, I may not really care what happens to this person, but that's pretty obvious. That's just it's startling to me how direct and how obvious their bias affected care.
I would add to what Kate shared and say that the remedy for this is pretty simple and easy. And every nurse knows how to take care of this. And so it's not, I'm trying to grapple with, someone may be able to guide me in this, but when we know what to do and we don't do it, right? What's happened, and is bias that much of a barrier to prevent people from doing what we know in basic practice to do? And I would say that about Kira's case and this young woman's case. We know what to do when these things happen. Was it the bias that kept them from taking action, or was it something else? And I think we definitely need to get to the bottom of it.
Hi, this is Annie Walters. How's everyone doing? I was listening, and for the young lady that just spoken, there's a difference between bias and prejudice. And I think when in both of these cases, I would say more was prejudice than biases. Because if you're biased and you took an oath to help someone in health care, you should have helped them. But because of prejudice, I think that's the stopping point. And the way African Americans is viewed these days is more prevalent now than ever. So we all have biases, and I can say, I stand and say I do have some, but I often check myself to make sure, because I work to save the children, and I make sure that whatever my biases are, that they don't stop me from doing my job to help people regardless of who needs the help, because I've been on both sides of the tracks, and I understand, as they would say, I've been on both sides of the desk. So in my profession, I go above and beyond to help anyone, irregardless. And I think when we look at bias along with the prejudice that being, and it's, again, I say more prevalent now, I think this what make people not care. And I believe if we start looking at individuals as human beings, irregardless of what financial category they fall in, what economical category, what culture they come from, what ethnicity they belong to, and we look at people as human beings, and I think that we will be better people, and everyone on this call have biases. I think the bias along with your prejudice makes these type things happen. I was listening to both of the cases, and my heart sickening. And I'm gonna say this: I'm a single parent with 3 boys, and I was a struggling single parent. And my children are very successful now, but my oldest son is 32, and I think my 2 little ones could have been no more than 3 or 4. The 2 young ones born with chronic asthma and bronchitis, and my middle son had a skin disorder. And I was working, a single parent working, put myself back through school. And I actually went to get Medicaid, and I had insurance because the medicine was so high. And then you talking 28 years ago, where they wasn't getting unlimited health care. And one of the caseworkers, the doctor, their pediatrician said, you go down to the DSS office just like your son is. My son has sores coming out of his mouth, around his lips, so they can see you need the help. She literally told me to get out her office and sit in the lobby, and dehumaned me so bad. But I needed that Medicare because I had medicine called $300 and $400, and it wasn't working for my middle sons, right? And I remember years later, I ended up getting my degrees in studying counseling, and I had to actually counsel her son who got on drugs and her whole family. She
remember saying to her, "This is what you did to me." And she started crying. She said, "I didn't know." I said, "You didn't know the stress I was under." But I didn't let what she did to me years later when God brought it back forefront. But I had the honor and the privilege to tell her. And I continued to help her with much passion. But because she judged me, she didn't even see my 6th son. She judged me for the color of my skin and treated me like crap. And we have to not stand for that, but things come back. And I'm done.
Well, again, I thank you so much for sharing your story. Your experience is definitely valued, and I'm sure shared by many others on this call and other women, who experience the same thing. And it definitely is real. We realize that bias is seen in all facets of our daily living, and it's unfortunate that care is not given the way it should be. And women aren't treated the way they should be. We're all the same. We're all from the same human race, and it's very unfortunate. Thank you again for sharing your story. All right, and I have one more case. This is Shalon Irving. Kimberly Seals from last week mentioned her name during her presentation. And mentioned that she was a maternal mortality case and has actually started, or her case has brought about a few other initiatives through the CDC. If you remember, she was an epidemiologist that worked for the CDC, and unfortunately became a maternal death. And I'm going to share a video clip of her. 1 second.
While Curisa is pulling up that clip, I think we will all agree that even though we're focusing on implicit bias, there are probably multiple factors that contribute to some of these unfortunate cases. And implicit bias is just one of those factors.
Thank you. I'm sorry.
Tell you what I think. I'm here to tell you what I know.
Okay. Can you all see my screen?
Yes.
Okay. All right, thank you. All right, so this is a video of Shalon's mother describing.
Shalon was my only daughter. She went on to become a well-respected epidemiologist at the Center for Disease Control. She had wanted to be a mother for so long. She was prepared. She did everything her obstetrician required of her. During the last week of her life, Shalon went to the doctor 3 times for the same symptoms. She was just dismissed with, "You just had a baby, give it time, it'll get better." I lost my vibrant, beautiful, intelligent best friend and daughter because she wasn't heard. I knew Shalon was a high-risk pregnancy because of her age, but I never for a moment thought that she was at risk of dying because she was a Black woman. My daughter went from being an excited mother to becoming a maternal statistic.
Okay. Again, that was the story of Shalon Irving. Bring up my PowerPoint once again. I'm going to briefly read you her story. Basically, she had given birth, and before she had been given birth, she was diagnosed with preeclampsia, which is high blood pressure during pregnancy. She went to the hospital after having her baby. She had because she had several concerns about a recurring headache and increased swelling. And basically, the nurse told her, "There's nothing we can do. You just have to wait it out and give it more time." Before sending Shalon home, the nurse gave her a prescription for a blood pressure medication called nifedipine, which is often used to treat preeclampsia. They got home and sat Shalon in her bedroom for a while, and she was basically laughing and playing with the baby. Around 8:30 p.m., she suddenly declared, "I don't know, Mom, I just don't feel well." She took the blood pressure medication and got ready for bed. An hour later, she heard her daughter make a loud gasping noise, and she had collapsed on the floor and died. As her mother stated, they went to the doctor 3 times after she had given birth, all because of her complaints of blood pressure and headache and increased swelling. So again, I want to ask, what do you think, or how do you think bias or prejudgments or dismissal played a role in her maternal death? Please again unmute your mic.
Hey, this is Tamika. It's really just the same story over and over again, and it's just the same, the same situation, and it's so sad because I know Shalon's story very well, along with Kira's. I did not know the other girl's story, but it's literally just not listening, and I think it's a little bit about it being women, and then also about them being Black. So it's like people in general, I feel like doctors don't listen to women in general. And then definitely not when they're Black. So it's kind of like, it's just really the same story over and over again. Like not listening, not caring. And maybe it's not caring, but just not paying attention and not taking them seriously when they are definitely in pain.
I would agree. And as like another follow-up question, does anyone think that Shalon's case or any of these other cases would have happened if they weren't a person of color?
I do.
Hey.
I don't think it would have turned out like this, because like from my experience, since everything happened to me, I'm in millions, not millions, I'm in groups, right, of people who've had the same condition, and they got care immediately, or that it was caught immediately, and they have their children. So I really honestly believe that if they were a different color, it would have been different.
Any other comments?
This is Ebony Harris. I was just gonna say, I feel like somebody made a key statement in one of the other cases that you have to care. And I think for me personally, it's a personal value as a provider. I put forth the foot that anybody who comes to see me, I'm gonna treat you as if you were my mother, my brother, my sister, my cousin, or whatnot. And I feel like that same value doesn't always exist among all providers. And so that, coupled with implicit bias, creates more of these situations. I can see from a provider perspective how sometimes somebody might get sent away one time, but when they're coming back again and again, and in all these cases, it's not that the person lacked the education. They were willing to do whatever that the person instructed them to do. It's that it's like, well, I'm not going to hear that maybe it's something that I'm not looking at. Maybe it's something that I'm not hearing this person say. They're just like, oh, it's fine, just go ahead. And that I found, at least in my practice, that anytime somebody comes back and repeatedly says something, you need to perk up and see, have you explored every option, and not just dismiss, even though that's the easy thing to do. Because if it was your mom or your dad or your brother or your sister sitting across from you saying the same thing, you would not want that to happen to them. So I think it's twofold.
Thank you for those comments. Anyone else?
Yes,
Hi, this
I
is
think as a
Cheryl.
provider, as a provider, we have to stop and think and look and listen to your patient and look at the record and not just say, okay, I'll just go home. And at least 2 of these patients, yeah, they were postpartum preeclampsia. We all know that even though most of it happens pre-delivery, they're still at high risk. And so if they're showing up with a headache, that ought to be top of the list as far as concerns, and then follow the behavior to follow through. And so is the whole healthcare team is at fault, because if you're not following, if I'm not taking the message, if I'm not passing it along, and you take somebody's blood pressure that's extremely elevated and then you have them sit down for a couple of hours, it's not going to get any better. And so that to me is just blatant disregard for human. So.
Thank you. And I think someone else was trying to speak as well.
Hi, this is Cheryl. I just wanted to add, I think some of it is, I mean, obviously it's implicit bias, but I think it's also the inability or not wanting to actually see the patient. So patients can present, but you have to take the time to actually see them. And as Ebony said, you have to care for them and be concerned. So it's really listening and seeing what they're trying to tell you, instead of assuming when you visibly see them that they're there for what you think they're there. So a lot of it is actively listening, but also seeing that person for who they are, and not just as another pregnant Black woman that's come in that may fit some stereotype that was learned along the way in the educational system. Unfortunately, this is not new for Black women. There's a history of this dating back many, many years. We have maternal problems. We've had Black women that have been imprisoned for drugs in the system. So this is not new for us. I don't know how we're going to fix it, but it is not new. And I think a lot of it is the implicit bias, the inability to see people, and then always thinking about productivity instead of stopping to care for the patient.
And thank you for those comments. And so after reviewing both of those cases, let's move on to recommendations.
So these are some recommendations that that we thought of, but we certainly in our last few minutes are open to recommendations from you all also. In addition to these recommendations, we put some of the implicit bias tests that are listed on the Harvard Implicit Bias website that you can take, and you might be surprised at how you score in some of these areas. I know that I certainly was. But as far as recommendations, a lot of the things that happen in healthcare are related to empathy or the lack thereof, when the healthcare provider doesn't necessarily see you as the same type of human as others, and that and the lack of empathy may lead to not necessarily providing the same level of care. So relationship building is important. In most OB practices, or some OB practices at least, women end up seeing several of the providers if there's a group of providers, but trying to develop relationships so that if you're experiencing a problem, that you can actually call that provider that knows you or has documented some of your histories, instead of going to the ED and being at their mercy. Of course, we know that depending on the time and all these things, people make different decisions, but it's certainly a part of it. always increasing awareness of implicit bias, making sure that all levels of healthcare providers have that education in their programs so that they can be aware of those implicit biases that they hold, and then can do things to mitigate those when they come up. And then know for the patient, knowing your body and listening to your body. And the last one is somewhat related to that. In all of these cases, I think these women at some point express in one form or another this sense of impending doom. And we know as nurses, we're taught if we listen long enough that the patient will tell us what's wrong, or at least give us a clue that it's something that needs to have our attention. For example, when we always are taught, if the person says it's the worst headache I ever had, yeah, that's a problem. We need to do something. So listening to those statements that give us clues about the sense of impending doom. So those are some of the ones that we thought about. And in our last minute or so, we'll turn it back over to the moderator and let you all have the final say. And we thank you again.
Well, thank you, Dr. Jenerette and Professor Tucker. We greatly appreciate what you've shared with us today. There's a lot to learn. I would like to just bring up the chat because there were some things that I thought might be valuable as we close up for the day. So individuals shared that stats make some people insensitive to truly assessing an individual, and bias could make that bad mental habit even worse. The importance of education and continued professional development needed in avoiding bias. So all of these things are in accord with what Dr. Jenerette was just sharing with us, but definitely worth mentioning. Are there any other questions that you would like to ask of our presenters this evening?
Hello, can you hear me?
Yes.
Yes, I don't have a question. I actually have a comment. I would like to thank the presenters today. It was very informative, and it's knowledge is key. It's good for us to just be made aware, or just make sure that we are always considering this information, and then we can pass it on to others. I think that's important too. We don't want to keep all this great information about what we learned today. We want to pass it on to other people so that they can be knowledgeable as well, and they can also be more self-directed in their care. You know, when we talk about the mothers, they need to be more self-directed. A lot of people are, but if we bring this to their attention, then perhaps we can avoid further mortalities occurring. So that is something I wanted to make aware of, that everyone should take this knowledge and take this information and pass it on to someone else in their family or in their communities, because that could definitely benefit so many people. So thank you very much, presenters.
Thank you. We appreciate you. Well, if that is it, Kate, is there anything more that we need to discuss with regard to CEUs, or is that information, they just look at that, they can read the slide and get what they need from that? All right.
And then I know Lisa is getting emails. So if you did not register but want to get the evaluation and potentially get those CEUs, you would need to email Lisa, correct, Lisa?
That is correct. So we will be sending out the evaluations. One of the data fields asks if you want contact hours. If you answer yes and it is approved, then we will get those contact hours to you. If you did not register and want contact hours, should they become available, just send us an email to our email address, which is midscbna@gmail.com. Again, the links to all 3 webinars will be posted on our website. The first 2 are already posted there. This one will be posted there shortly. So thank you all.
Thank you, Kate. Thanks very much. And that's the conclusion of our webinar for this evening. We appreciate you all being present with us today.
Thank you.
Thank you.